Welcome to Vitality. All we do here is to bring health is closer to your nearest doorstep. So today talking about one of those sexually transmitted diseases that is very, very common in the society. And I have here with me pharmacist Blessed Ekong, who will discuss with us this condition, because I can tell you that this condition is one of the most common conditions and it can lead to a lot of complications. And one of the major complications it can lead to is infertility. So we are here to talk about gonorrhea, and I have with me here pharmacist Blessed Ekong, who will share for us an in-depth knowledge of what gonorrhea is all about, ranging from the symptoms of gonorrhea, the signs and symptoms of gonorrhea. Then from there, we'll also talk about the complications, we talk about the diagnosis, the preventions, and at the end of the day, we to share us knowledge, because at the end of the day, we want to know what gonorrhea is, and then we'll also talk about, give you a preamble of the dangers and the complications associated with gonorrhea. Stick around because you are going to get the best out of it. Welcome, pharmacist Blessed, welcome to Vitality.
Thank you, pharmacist.
So, like I've said, pharmacist Blessed, we are going to. I want our audience to have a full knowledge of this condition, because it's one of those conditions that affects a lot of people out there, and most times they actually share these conditions to their village people because they feel that the complication associated with these conditions is caused by someone like, gonorrhea can lead to infertility, in which most of them do not even know, and they don't even know that gonorrhea, as simple as gonorrhea is, it could lead to infertility. So I want you to tell us today, because we want to discuss so that our audience will have a full knowledge of what gonorrhea is all about and the dangers that someone has out there need to be very serious about when it comes to treating gonorrhea. So what can you tell us about gonorrhea?
Thank you very much. Many people are ignorant about what gonorrhea is all about. So, gonorrhea is a bacterial infection. It is generally caused by Neisseria gonorrhea.
Okay.
That is gonorrhea. So now, this bacterial infection, like this Neisseria gonorrhea, it thrives in most areas of the body, such as the reproductive tract, urethra, throat, and also the rectum.
Okay.
So that is gonorrhea.
So it basically thrives well in the warm and moist.
Yes, most
so
areas of the body.
Like the our female reproductive organs.
You understand?
So
that's really thrives.
Okay,
thank you. Most areas.
Okay. At least you can hear that gonorrhea is one of those things that thrives very well in moist environment. So from Pharmacist Blessed Ekong, having tell us this, can you tell us how gonorrhea is being spread?
Yes. Gonorrhea generally it spreads in the body. So now there are two main places this gonorrhea spreads. One, when you have true unprotected sex. That is unprotected vaginal, anal, and also the oral sex. Once you have this, gonorrhea spreads a whole lot. That's one of the places gonorrhea spreads. Then we also have when a pregnant woman, a pregnant mother gives birth, like during childbirth, gonorrhea can also spread. So it can be passed during childbirth. This is the second one. So now, though it is very rare, through shared contaminated objects like the sex toys, it is very rare.
It
is very, very rare. So all this,
it can happen.
But it can happen.
Okay.
All these ladies using dildo and stuff like that.
Okay.
Yes, it can happen. Through sex toys.
So you have said that gonorrhea can spread through the oral sex because there's some
maybe some people will not really understand what oral sex is all about.
No, we are here to educate people, because at the end of the day, all Vitality cares about is to bring health tips closer to you as much as we can get. So when we talk of oral sex and gonorrhea, a lot of people don't know that oral sex could lead to gonorrhea. Because a lot of guys, after they are given being given a blowjob, at the end of the day, that's when they will go and wear contraceptives. So I'm always like, what are you protecting?
You
understand? Because already there are some things you might have gotten through the mouth. You understand? Which are one of those things we have mentioned today is gonorrhea. In as much as what is down there in the main center of our event is another thing entirely, but at least even from the mouth, that shows that you can also get a lot of things. And gonorrhea is one of those things that you can get through oral sex. And you mentioned our sex toy. Well, like you said it's rare. It's very rare.
It's very rare.
But that doesn't mean that it does not happen.
No, it doesn't. We shouldn't be ignorant about it. We should be cautious.
Okay, so like Pharmacist Blessed Ekong has said, he said that sex toys could also be a major channel in which gonorrhea could be spread from one person to another. Though it is rare, but that does not mean it could be ruled out completely. So while you are using those things as a lady, as a guy, those sex toy out there, you should also make sure that you always sterilize it. Make sure that at the end of you're using it, at the end of each event, it is kept very clean, neat, and tidy, because you don't know how these things might be transferring infection from one person to another. Thank you, Pharmacist Blessed Ekong, once again for bringing this, because at least I've learned something today, that sex toy could also be a channel in which this gonorrhea could be passed from one person to another. So having said that, I want us to discuss on the symptoms of gonorrhea. Because some of these symptoms is what a lot of people don't pay attention to.
Yes.
The most common symptoms are the ones people know, but I want us to discuss the symptoms. So let us start with the men. What are the symptoms of gonorrhea that are very peculiar to men?
So in men, practically once you get in contact, once you're sexually active with the woman, maybe you start experiencing one of the symptoms. You start experiencing some burning sensation or painful urination on the tip of your penis. That is the first thing that happens. that is in men. No, you might be actually laughing, but it's true.
Okay.
Once you get this painful urination while urinating, it happens.
Okay.
That means you've contacted. You really need assistance from there.
No, sorry. Before you continue, gonorrhea is often regarded as clap.
Yes, it's actually a clap.
Is it because of that pain that when you are trying to, that burning sensation, is the name coming from there?
Do you know that? Sometimes when you want, normally what is clap? Once it claps you, that's when once you try urinating, you understand the first line of urinating, that's the clap.
Okay.
It comes. It's just like a tingling sensation.
Okay.
So once it comes, that means the pains will actually comes in between as well. So that's the painful urination, the burning sensation.
Okay.
So the second one is a pus-like discharge from the penis. Once you see pus from your penis, like it's actually three other colors, like white, green, or the yellow color.
Okay.
Those are the various colors, like the pus-like discharge. So this is the second one. This is the second symptoms from men you actually see. Then the other one is a swollen or a painful testicle. This particular one, it's very rare. It doesn't occur like that. It's very, very rare. The painful testicle.
Okay. So thank you very much once again. So like Pharmacist Blessed has said, talk about painful urination, burning sensation. Once you notice this sign out there as a guy, as a man, please don't take these signs for granted. Always make sure that you reach out to your healthcare provider for you to get proper counsel and treatment as soon as possible. So I want us to discuss on the symptoms peculiar to female, because even some female don't really pay attention to these things, because they may just feel that maybe it's a hormonal imbalance, because some symptoms of it might be like hormonal imbalances. So please, can you tell us some symptoms peculiar to female?
In women, once you have an increased vaginal discharge, the discharge is different from other discharges you have, maybe during menses or stuff like that.
Okay.
Once it is increasing, increased vaginal discharge is one of it. That's for the ladies. Once you have this, just know that that's actually one of the symptoms of gonorrhea. And also you also feel a painful urination while urinating. Once you feel these pains, then you've contacted as well. So these two things in ladies will make you understand that already gonorrhea is on the way. That means you need to get yourself treated, because if you don't do it, it might actually lead to a lot of complications as well.
All right. So but also, what about painful penetration? Because sometimes symptoms of gonorrhea could also make a lady to have that painful penetration once a guy is about to. That could also be another sign.
Could also, even if there's actually one that once you start bleeding immediately after sex or between your periods.
Okay.
This bleeding is also another symptom.
Okay.
Of gonorrhea. Then you also feel some abdominal pains. That's the pelvic or abdominal pains in ladies as well.
Okay.
So this is also another symptom.
So like you have listened to Pharmacist Blessed tell us, sometimes you might be having bleeding in between your period. That could also be a sign of gonorrhea that you don't need to take for granted as a lady. Please always ensure that you look out for these signs and then lay complaints to your healthcare provider as soon as possible. You made mention of oral gonorrhea. Can you share some symptoms associated with oral gonorrhea?
In situations with oral gonorrhea, you have once you start feeling sore throat,
Okay.
Yes, there is. Once you have this sore throat, frequent, it comes very frequent. So once you have the sore throat, just know that that's another symptom. Soreness in the throat. You feel sore in your throat.
Okay.
That's another symptom as well.
Okay.
For the oral gonorrhea symptom.
Okay. So how about the rectal gonorrhea?
Yes, for rectal gonorrhea, you have excessive discharge, itching in the rectum as well.
Okay.
Then you also feel sore. There's soreness. Then specifically there is pains in the rectum as well. So once you have all this, just know that
Gonorrhea is on the way.
Gonorrhea is on the way, just like I said the other time.
Thank you once again. So we have discussed some signs of this gonorrhea, because gonorrhea, I can tell you, is one of the silent culprit that a lot of people don't take for granted. In fact, it is very quiet in the ladies. Like 50% of the ladies don't even know that they have this gonorrhea. But it's 10% of the men will always be aware that they have gonorrhea. So like he has mentioned a lot of symptoms that we don't need to take for granted. Please pay attention to these symptoms. And when you have this symptom, please always reach out to your healthcare provider for proper counseling, testing, and then possible diagnosis, because you need to get treatment as soon as possible. So pharmacist, let us talk about the diagnosis of gonorrhea, because a lot of people don't know that there could be good diagnosis for them to get a counsel and treated for this gonorrhea. So what are the diagnoses you want to tell us today?
Yes, but before then, let me just give just a genuinity. About 50% of women and 10% of men doesn't know they have show no symptoms to gonorrhea. So if left untreated, it leads to a lot of complications.
Okay.
Now, when do you get tested? Just like the diagnosis, one is when you feel these symptoms. When you know that you have an STI, you have these symptoms, you need to get yourself tested. Then also when you are sexually active, or when you have multiple sexual partners, you understand that is when you get yourself tested immediately, because you don't know what you've gotten yourself involved in. So now there are different parameters used for this diagnosis. One is the urine test.
Okay.
For the urine test, it's just a very simple test that detects the presence of this bacteria.
Okay.
That's for the urine test. Then we have the swab test. Swab test from the affected areas. Like the throat, the urethra, yes, and also the cervix.
Yeah, the vagina as well.
Yes, the vagina as well. Then from the swab, once you swab it, the scientists, they know what to do from there. That is, these are the two main parameters you need to use for diagnosis of gonorrhea.
Okay, thank you once again for stating this out, because a lot of people don't really pay attention to their health until when serious complication comes up. Because I've seen cases, or I've even seen cases of untreated gonorrhea leading to serious damages in the reproductive organs. And sometimes these things are something that a lot of people didn't pay attention to when it was happening. Mm-hmm. They just feel that it's a normal painful urination. They just enter a pattern medicine shop, get some get some painkillers, and then they use it. Once there is no pain again, they continue. And then for people that have multiple, let's say, multiple body counts, people that have a lot of multiple sexual partners, they are also at the risk of it, because these things are what could lead to serious issues, and they could be passing this in from one person to another without them knowing, and at the end of the day they're blaming people for what happens later in life. So we have mentioned some diagnosis of this gonorrhea, so we want to go into
even the scientists will actually use the lab cultures, lab culture tests as well, to confirm the infection and also detect antibiotic resistance. Okay.
So we have discussed the diagnosis of gonorrhea, what one needs to do to get tested, and also to know that he or she is having gonorrhea. Let us talk about briefly before we go into the complication, because that's why we want to discuss mostly on. Let us talk about the treatment options available for, because once you are diagnosed, we expect you to get some treatment, good treatment. So what are the treatment options available that you think will give them the best result?
Presently, the standard treatment regimen is a single dose injection of antibiotic ceftriaxone.
Okay.
Once you use ceftriaxone, single dose, and sometimes you combine it with doxycycline or the azithromycin. This to treat co-infections like chlamydia.
Okay. So because here we don't really like to mention drugs. Because we always want to refer them to our healthcare providers that will counsel them and then write this one, because I believe in individual treatment.
Yes.
Because like ceftriaxone, a lot of people are resistant to ceftriaxone already. Even the doxycycline that you have mentioned, a lot of guys and ladies out there are resistant to these things because they self-prescribe them to themselves.
Yes.
So as such, it's no longer working. So I'm an advocate of individual prescription.
Go to the
Meet your healthcare provider, get treated, get counseled, get diagnosed, then get your treatment, knowing that it is just ordained or prescribed for you.
Yes.
So I'm an advocate of this. So let's discuss more on the complication of gonorrhea, because a lot of people don't pay attention to these things, like I have said a lot. So let us discuss on men. What are the complications associated with gonorrhea when it comes to men?
When it comes to men, there's a condition called epididymitis. Epididymitis is just a condition. Once you get this condition, it might lead to infertility.
Okay.
That's for the men.
Okay. So because I have seen a condition where a man is always like very angry, expressing anger issues with the wife, not knowing that he has had issues of these things. And when we was counsel, family history and other stuff like that, after a lot of counsel and then trying to take the past medical history, the guy had gonorrhea in his early stage of that, but it wasn't treated properly. So that leads to the damage of those things that you have said. And at the end of the day, we'll be associating these things to village people or maybe friends that they feel that people don't want them to progress. Whereas these things is what they felt that it was not necessary for them to get proper treatment. So please, as a guy out there, once you get these symptoms that we have mentioned, always ensure you get proper treatment, because gonorrhea could lead to infertility, could lead to serious infertility in a life of a man, because once it damages that epididymis that stores and carries sperm, that could affect the movement of your sperm to fertilize eggs, and at the end of the day, it could lead to serious issues, and it can even spoil your marriage at the end of the day. So always pay attention to these things. And then Pharmacist Blessed, how about the women? Because the women are not left out at the end of the day.
No, they can never be left out in this situation, because it affects both the men and also the women as well.
Okay.
So for the women, you will see them developing pelvic inflammatory disease called the PID.
Okay.
Nowadays, you see those conditions. It's very frequent. So, and also ectopic pregnancy. Once a lady has an ectopic pregnancy, that is a condition whereby the fertilized egg is implanted outside the uterus.
Yes, outside.
Once this ectopic pregnancy occurs, it's most definitely from untreated gonorrhea. So once it happens, it affects the ladies.
Another complication is the newborn. So what's your take on that?
The newborns, most generally you see an eye infection.
Okay.
An eye infection, it's very, very general, because that is from the mother during pregnancy to childbirth. Okay. You see an eye infection, and if left untreated, it leads to blindness.
Wow.
Immediately, instantly, it leads to blindness.
Wow. So please, for the mothers, especially the new mothers, please always ensure you visit the hospital for your antenatal. It's very, very, very important for you to always ensure that you visit the hospital as early as possible for your antenatal, and then get treatment as soon as possible, because these things are things that a lot of people don't pay attention to.
They don't know.
They just feel that, okay, because in fact, especially people that want to deny pregnancy. There are a lot of people that I don't want to give birth, my body will spoil, my body will do this, and at the end of the day, you got pregnant. And maybe there's a guy that wants to take responsibility. At the end of the day, we refuse. Even when some guys give their ladies money to go for antenatal, I can bet you that some of them might not even go. Some of them can even use that money and buy wig, because they I don't know.
It's
yes, a lot of them can use the money to buy wig, use the money to buy some jewelries, but forgetting that the child in your womb is the future.
Health is very paramount.
Health is paramount, because if you cause blindness to that child now, you start pointing fingers
to your
village people, to your enemies. Whereas your enemy is just enjoying his life without worrying about what you are going through. So please, for the mothers, the first time mothers, please always take your antenatal very, very serious, please. And once, especially if you're an organized couple that wants to take in, please always ensure that you get proper counsel, get proper treatment as soon as possible in all this area. Get tested in all aspects, so that, because you want to bring a child that you can look at the child and then even you'll be happy.
Yes,
you don't want to bring a child that has a blind eye already, and at the end of the day, you start blaming people. No,
Yes.
it's out of the carelessness or laziness in your own part. So let's talk about both genders. What are the complications that gonorrhea could cause in both genders?
Once it is left untreated, there is an increased risk of developing HIV
Okay.
and AIDS. Once you leave it untreated, you know what it means to leave something, to overlook something,
Yeah.
be ignorant about it. Before you know, you expose your immune system to a lot of things. So once you leave it untreated, there is increased risk of HIV.
Okay.
And once you contact it, that's all.
So I believe you can hear what a pharmacist Blessed is telling us. So always ensure that you don't leave this thing untreated, please.
Then there is what we call the disseminated gonococcal infection.
Okay.
That's the DGI.
Okay.
This is actually a very serious condition in which once this infection spreads to the blood, the joint,
Wow.
and other areas of the body.
Wow.
So this is another condition for both genders, DGI.
Thank you, Pharmacist Blessed, for sharing your expert ideas on this issue, because, like I said, it's one of those issues that affect our local communities.
Yes.
In fact, most of them don't even pay attention
No,
to
they
it.
don't
They
pay
just
attention
feel
to
that
it.
maybe they sat down on something. That's why they are beginning to have discharge, or maybe they ate the toilet. So some of the people are showing the toilet infection.
Toilet infection.
Like the ladies, they always say it's toilet infection.
No, it's always very funny when you interact interact with someone. The person will definitely tell you, this is what I have, this is what is happening, and he or she might actually want to counteract your own counseling, which is not supposed to be so.
Yeah, no. When I used to practice in the community pharmacy, I used to see stories like that. In fact, sometimes you just sit down and look at it again, and then ask yourself, is it that the person feels you don't know what you are doing, or you don't know, like, you have gonorrhea, good and fine, but why are you coming to tell me it's toilet infection?
You understand?
Do you understand? Then are you sexually active? No. Are you doing this? No. But at the end of the day, how did you contact it? Yes, you can get it through, like you said, sex toys, but it's very rare.
Very, very rare.
You understand?
Very,
So
very
meaning
rare.
that 80% chances is through oral, vagina, or anal sex. You understand? Sexually transmitted. But now you come and be denying that you got it from toilet. And so I think people also have to, you don't have, that stigma is another thing people should rule out. It should be open so that you can get the best treatment possible. So having said this, I want us to discuss on because in Vital D, like I've always preached, what we do here is what can we do at home to prevent these things? What can we do in our day-to-day activities to ensure that we curtail or we limit or we reduce the spread of gonorrhea, because it's affecting our local communities, I must tell you. Because people in the township areas might not really know that it still exists.
No, it doesn't.
But if you go to primary health care
It
centers,
exists.
you see people coming down with issues of gonorrhea, meaning that
It
it's still out there, and most of them are still hunting young guys out there.
It is very, very common.
Yes, it's common.
Very, very
It's common. Gonorrhea is very common.
It affects most people globally.
I've seen someone that cried during the process of trying to urinate.
No, it's true.
Yeah, I've seen. In fact, when I saw it, I was like, I had pity on the guy, because empathy, because I was like, why is this guy crying? So when I walked close to the guy and I saw what he was going through, even me, I was like, wow. So this thing could be this serious. So please, it's something very serious that you don't need to take for granted. Gonorrhea is one of those things that could mess you up as a man. If you can reduce your steez to zero. You wouldn't want to be trying to urinate in public environment and then you are crying. Yeah, you're shivering just to urinate. Always ensure that you get treatment as soon as possible. So in the aspect of prevention, because that's what you preach here.
Yes.
What can you share for us? Because
in order to
right.
reduce this spread and also all these culprits, in order to reduce it drastically, you must do a safe sexual practice.
Okay.
What am I even trying to say? Like sex practice. First, you need to use of condoms. Yes, you need use of condoms.
But a lot of people also say they don't feel comfortable using
condoms. But if you want to reduce this, you need to use condom.
Okay.
Use condom. There's a sex this thing. lubricant you can use actually to make yourself comfortable. I'm not saying, I'm just saying this to the public to really realize the point that condom is very, very necessary in order for you to reduce drastically the spread of gonorrhea, or for you not to contact it. Be very free to use condom, and also you need to avoid multiple sex partners. You have to avoid multiple sex partners. So because once you practice this yourself,
that means if you don't want to use condom, you should have a single sex partner then.
Yes, have a single sex partner
in which both of you are loyal to each other.
But loyal, can you rate loyal?
But it's not possible, man.
It's not possible.
It's not possible because
it is loyal, just like you said, loyalty right now. I don't really know what to say, but loyalty.
At the end of the day, let's use condom.
Let's use condom. That's the best.
Because
avoid multiple partners.
Yes.
And also use condom. Except unless you're married.
But this issue of unless you're married, it do a lot of because sometimes you can even be saying that married men are even carrying the gonorrhea more than single guys.
It happens.
So
it happens. You will not actually confirm this. It happens as well.
Okay.
You understand?
Because in fact I have seen issues of a married man having issue with the wife because of the husband came down with, he was diagnosed of gonorrhea, and he didn't get it from the wife. Do you understand? Mm-hmm. So, and the innocent woman is out there trying to be a good woman at home, and you as a man, you are spraying your tentacles left, right, center.
You're playing around.
You are playing around, dancing around. At the end of the day, the innocent woman will be at home, and you carry nonsense and go and give the woman at home. So please, for the men outside there, please, let's normalize the use of a condom. In fact, it's not just gonorrhea.
It's not
condom will help you from a lot of STIs. It's not just. In fact, have you noticed that lately people are not even afraid of infection
at all?
People fear pregnancy more than infection.
It's true.
They feel that there are drugs you can take an infection to quit, but they forget that there are infections that drug cannot help.
It's true.
You only stay on the drugs.
You only reduce it, or you only reduce it.
Yes, reduce it. You stay. Yes, you still come back. You stay on the drug. In fact, I've seen instances where a lot of young guys don't want to use condom. They feel that they say condom always make them feel don't feel the vibe of what intimacy.
They don't enjoy intimacy with condom. You know, but to some extent, I'm not doubting that. Generally, I really understand what they feel. But you still need to protect yourself. Because if you don't protect yourself, you're exposing your immune system, and that's bad.
That's bad, actually. You're right. You're very, very right. That's bad. So please, for the guys out there, please normalize the use of condom. Even when you say it, I trust my partner is this. I think that there's a point you need to get to a lady for you to trust that lady.
Yes, there's a point. Actually.
Yes, there's a point you need to get to, and that point comes with a lot of commitment. Not commitment that you bought with money, because
self-commitment.
Self-commitment. If you buy commitment with money, one day is higher bidder. The commitment
is gone. It's gone.
You understand? No, it's gone. But if you buy commitment out of your words and out of being truthful and straightforward over time, there will be commitment.
It's true.
But if you use money to buy commitment, over time the commitment, once there's another bidder that pays more than you, the commitment is gone.
Yes.
So I think the guys out there, please, let's normalize the use of the condom while making intimacy, because it also helps to reduce the spread of this gonorrhea. And then even for the ladies, always encourage your spouse, you understand, to also buy this condom.
Just like you said, they are even if you go to health centers, they are female condoms.
No, they are female condom, but a lot of females are not aware.
They are female condoms.
Because those don't even know how to use it. But let them encourage their men, you understand, or their man to buy these things for them to be easy. Especially when you know that you are not loyal to your man, and when you also know that your man is not loyal to only you. Because sometimes a lady can be very loyal to a man, but the man wants to spray tentacles. Then also in the other way, that a man might be very loyal to a lady, but the lady not being contented with one man business. He wants to test a goosey, test a bono, test vegetables. But at the end of the day, we encourage everybody to use condom, please, because it will help you to reduce the spread of these infections from one person to another. So what other preventive measures can you mention for us?
We also have regular screening.
Okay, regular screening.
I think if this really applies to guys under 25 because I think it's very rampant. You need most of them. They have different partners, but it applies to everybody. Regular screening, get yourself tested. Go to a scientist and a good med laboratory. Get yourself tested. Be screening yourself. Make sure you evaluate your system.
Okay. I think
that will help a lot.
I think that this screening you are saying, a lot of people don't even get tested at all.
No.
It's only when they are sick and they are being taken to hospital.
Once they are sick, that is when
that's the only point.
There is what we call hospital.
Yes. but do you know that it is very, very important that you get tested or get screened at least
get screened
on a quarterly basis?
Yes.
Like every after or every other quarter. You need to get yourself treated as or get counsel and then screen yourself as soon as possible. So what other method or can you tell us?
Just once another to be able to avoid is just multiple partners should be detained.
Please
reduce it.
Please
reduce the aspect of getting multiple partners, and with these multiple partners you're not even using the CDs, the condom we talked about. So please reduce multiple partners as well.
I wish they will listen to us, or they even click to watch this video and then get value out of it. Because at the end of the day, these are the values we bring to you. Because if you're having multiple sex partners or in fact multiple body counts,
yes,
like because a lot of them don't even know the body count again.
At all.
Like they have been so soaked into it that they don't even know the number of multiple sex partners they are keeping. So these things you are at the risk of transferring one. It's not just gonorrhea.
Right.
You're at the risk of transferring one infection from one person to
another.
I think another way to prevent is also sex education.
Yes, sex education.
That thing should be something that is being introduced even to secondary schools.
Yes,
because it also exposes them to this seriousness of this infection, because a lot of people don't know how serious it is.
That is why I like the new generation aspects now, developers. They are now there's what we call foundations.
Okay.
They now go down to secondary school, schools, and
a lot of foundations are trying.
Yes, I like.
In fact, some of them even share sanitary pads to the ladies.
Yes.
Even educate them on sex, the do's and the don'ts regarding sex.
Yes.
So it's also very, very important. Pharmacist Blessed, thank you so very much for taking your time to share these things with us today on our Vital D podcast, because what you have shared today on gonorrhea is what people don't really pay attention to. So thank you very much, our audience, for always sticking around with Vital D. We want to say a very big thank you. Like a short summary of what we have said. We talked about gonorrhea, which is a bacterial infection, sexually transmitted infection caused by bacterial Neisseria gonorrhea. It's a very serious infection that you don't need to take for granted. In fact, it could even cause your marriage. You understand? It could even, because it could lead to infertility. That could cause your relationship, that could cause your marriage. Please always ensure that once you notice those signs and symptoms that we have talked about in this podcast, in this show, you go to your medical practitioner, get counsel, get diagnosed, and then get treated as soon as possible. Because once you do that, you are going to reduce the spread of these infections, and then you're also going to limit ensuring that you get treatment as soon as possible. Also adhere to a single, also limit the spread of in this infection by limiting the number of sexual partners that you have as a man, even as a woman. Also ensure that you use condoms. Contraceptive condoms is very, very good. You use it because that will also help you to prevent this infection, not just unwanted pregnancy. It also helps you to prevent the passage of these sexual transmitted infections from one person to another. Then at the end of the day, always ensure that you keep yourself clean, neat and tidy, and then prevent sharing sex toys, because that could also be a channel in which gonorrhea is being passed from one person to another. Though very rare, but that does not mean it could not happen. So at the end of the day, please, we want you to stay healthy out there. Thank you for staying around with Vital. Please, if you have not subscribed, make sure you subscribe to Vital D, because all we do here is always bringing health tips closer to your nearest doorstep. Stick around because we will bring you more health tips. Till then, see you next time.